Still ahead here at 6, it may seem odd, but there's a new hope to reduce carbon in the atmosphere. How these 40-foot towers in the Central Valley could be the future of battling climate change. Plus, the new allergy drug being tested here in the Bay Area will tell you how it could reduce severe allergic reactions from some foods. We'll be right back. Today, a new medical report was published that provides strong evidence about the benefit of a newly approved treatment. It's a drug that can reduce severe allergic reactions triggered by certain foods. The research was conducted at multiple medical centers across the nation, including a major site right here in the Bay Area.
Milk, eggs, peanuts, you name it. These are just some of the foods known to trigger an allergic reaction, some very severe. These allergies are on the rise.
Over the past several decades, food allergies have really been exponentially increasing, not just in the U.S., but globally.
Research shows how 1 in 10 adults and 1 in 13 children have food allergies. Accidental exposures to potentially deadly foods can be terrifying. Dr. Tina Cinder is a food allergy specialist at Stanford.
So it really does impact quality of life, not just in what you're preparing and eating yourself, but not having the ability to control foods in your environments. And we do see lots of accidental exposures that lead to allergic reactions.
Now, Stanford and Bay Area patients have shown how an injectable drug already approved to treat chronic asthma can reduce the risk. All the patients in the study are severely allergic to peanuts and at least 2 other foods.
We would give them the foods they are allergic to in an incremental fashion until we can elicit an objective reaction. At the end of 16 weeks, about 67% of those who received injections, they were protected up to that much of the allergen after 4 months.
Dr. Cinder explained the injection given every few weeks is meant to help reduce severe allergic reaction. It's not a cure.
We're not recommending they go eat the food, but cases like this where they have accidental exposures or they're terrified of the person sitting next to them in the plane, they are protected against those accidental exposures and having severe reactions due to them.
The drug is called Xolair. Based on the study's data, the FDA has already approved the drug for this use.
At Stanford, researchers tested patients as young as a year old. They said the drug did not cause any side effects other than some instances of minor reactions at the site of the injection.
Well, still ahead on CBS News Bay Area. A Bay Area school district needs to find a way to raise money, but a proposed solution is facing some pushback, all because of a community garden. Plus, a Bay Area bakery is left in the lurch after Tesla cancels an order worth thousands of dollars. How the community came to its rescue. And a drug could drastically reduce dangerous reactions to food allergies in kids. A Stanford doctor joins us to explain how it works. There could be a breakthrough in treating food allergies, especially in kids. Researchers at Stanford Medicine say there is a drug that could prevent dangerous allergic reactions in children. The CDC says about 8% of kids in the U.S. suffer from some sort of food allergy. Dr. Sharon Chandraja with Stanford Centers for Allergy and Asthma Research joins us now with more on all this. Let's start with the basics. How does this drug work, and how young is too young to start taking it?
Oh, well, thank you for having me. This is a huge breakthrough for our food allergy families. This drug, omalizumab, also known as Xolair, works as an anti-IgE. It's against allergic antibodies. And our food allergy patients make allergic antibodies to proteins in foods, which causes reactions that we all get scared about. And so this drug takes those allergic antibodies out of circulation.
Unbelievable. It's funny. I have 2 little boys, and I know so many parents where they have this constant daily struggle with their kids who have allergies to foods, and it's terrifying. And especially if your child wants to go to a play date or a birthday party, you really have to plan ahead. It's very difficult. So For parents with little kids, what signs should they look out for that a child may have food allergies?
Oh, yes. I know food allergies can be diagnosed at any age, and a typical reaction occurs right after you eat a food, and you might notice hives or a rash on the face or anywhere on the body, nasal congestion, coughing, sneezing, vomiting, a tummy ache. And normally it happens within minutes of eating that food, but can occur up to 2 hours after eating that food.
So how does this drug work? Is it an injection? Is it a spray? Is it a pill? How often does the child have to take it?
Yes. So the way we studied it, it's an injection every 2 weeks or every 4 weeks. It depends on how allergic you are. And you take it for a long period of time because food allergy is a chronic disease. And our study led to the FDA approval of this drug now for food allergy kids as young as 1 year of age and adults. So
Wow.
it's really amazing that this can offer a level of protection for children and adults.
Now, how long would patients need to take this drug? Is this something they would have to do for the rest of their lives? Or I know a lot of kids end up growing out of their food allergies.
Yes. So as far as we know right now, you have to take it for the long term until more research is available to understand how long we have to take this. And it's shots aren't easy for many, but certainly allergists are familiar with how to make this easier for patients to tolerate.
Now, has this been approved by the FDA? Are you starting to use this in patients that you see in your own practice? What's the efficacy of this?
Yes, so it was just approved by the FDA last week based on the study findings from our Outmatch study. And in that study, we saw that it can reduce the risk of allergic reactions to multiple foods in 2/3 of patients who are on this drug.
Wow.
And that's huge because we tested to amounts that are easily encountered in accidental exposures. This will change the way that our food allergy families live their daily life with
Yeah.
this level of protection.
Yeah, no question. I know there's a lot of different strategies on how to handle food allergies in kids, and one of them being kind of microdosing, exposing the child in small doses to foods that they have allergies with. Could you do that therapy in conjunction with this drug, or are they two kind of separate philosophies?
That's a great question. So we just published the first stage of our Outmatch study, which is just the injections alone.
Okay.
The next stage is looking at exactly that. Can we combine this with other approaches like oral immunotherapy, where there's microdosing of the food that you're allergic to?
Wow. Unbelievable. Great research there. All right, Dr. Sharon Shinthraja with Stanford Healthcare. Thank you so much.
Thank you.